yes, my friends. Very nice, welcome. There is this short topic that I want. There are some topics that are short topics that I really want to get away with, so that if someone asks me a question on any topic, I'll be sending that person to a link that is yes. So this topic that I want to do right now, this is a topic concerning blood pressure, and there is a system called angiotensinogen, renin angiotensinogen. Barbara's world. Oh, welcome, Barbara. I changed your number to a closer number so that you know what I mean. I really want to support Barbara, so I changed her to a closer number, a number that is like close, so that we can she can have what she needs. You know, she's a go-getter. So, Barbara, you've seen the updated list has a closer number. If I get another closer number, I will push you forward. Now, as you have seen, we are still on pressure, and um, we are talking about a system called the RAS system. RAS system. RAS system. RAS system is a system of the body. I want to put it here. This beam that you are seeing, this beam, this one is a kidney. And I want to explain how the RAS system works. See, not raster, not raster, RAS. RAS system means renin, angiotensin, aldosteron system. Aldosteron system. Your blood pressure is not just regulated by your heart. No. As we talked earlier, I said I will paraphrase about the I will paraphrase about the kidney, how the kidney helps you when it comes to blood pressure unit. So there is something called the RAS, not Rastaman, RAS. The first one, the RAS, this one, the RAS system, the RAS. So this one means a hormone called renin. The first one, and then we have the second one. I really want people to understand how the kidney works. This one is angiotensin. 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 You see, angiotensin. Angiotensin is the second one. Eh? I want people to know how their blood pressures are regulated. And then aldosterone. 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 Aldosterone is a hormone that loves salt. And then we have something else called antidiuretic hormone. Antidiuretic. You remember me talking about I don't want to lose water. Anti means I don't want. Diuretic means water. So it is I don't want to lose water. Now let's learn something that is so fast, and then we go to the topic of the day. And you feel when I'm at night shift and the people have relaxed, no movement, I take some short lessons like these ones, and then I come online so that they can help us. Now, this is how your kidney works. This bead is your kidney. Blood comes from above, from the vein that you are seeing above. It goes inside some small pockets These pockets are called Bowman capsules. Do I have a picture of Bowman capsule? Yes, I have. This blood goes to the small pockets. These small pockets, remember, I will explain how the kidney works. But today's topic is about the blood pressure. So if you are watching, please watch as you like this video. Watch like as you like the video. Please watch as you like the video. Let's get, if you like, it will give an impression to someone else, and then we continue. Now, this one is called the Bowman's capsule. You see this thing I've drawn here? This one is called the Bowman's capsule. It is called the Bowman's capsule. Bowman's capsule. It is inside your kidney. So, the Bowman capsule is the one which filters your blood. Is the one which filters your blood. And I want to put it here so that we can learn how it regulates your blood pressure. Don't forget to give me a like, man. I like being liked. I like being liked. I like being liked. Wow. I like being liked. Yes, I like being liked. I like being liked. Present like that. Yes. Bowman capsule. Let me drop this a bit so that you can see like that. Like that. Then we turn this one like that way. Now, the Bowman capsule here is where your blood gets filtered. Where your blood gets filtered. And here, this bean shaped that you are seeing is the kidney itself. But today, we are not going deep into function. We want to know how the kidney regulates blood pressure. You get it? This is very important when we are talking about how J. Kingre is here. Yeah? J. Kingre is here. Just a minute. RAS explained. We call it RAS explained. So if you like, someone else will join us, and then we will get more. What is happening? I'm trying to click some issues here and some. Yes, just a minute, my guys. Just a minute. I set up this. Just a minute. Just a minute. Our focus today is how this bean-shaped tissue organ balances your blood pressure. It is very simple, and you will see that the simplicity in this comes not so confusing. Very simple. I'm trying to do some issues here. You know, when it is raining, this place sometimes it is raining outside, so sometimes network misbehaves. Yes, but don't worry, my guys. Don't worry, my guys. Let's continue. Let's continue. Yes. Let's continue a bit. Yes, that one is okay. Now, we have said blood enters through this vein and filtrates come out through this vein. But inside here, as the blood comes into these small capillaries, these capillaries that you are seeing here, these end things that you are seeing here, they are called the Bowman capsules. I've drawn a bigger one here that you can see. It is called the Bowman capsules. These Bowman capsules, what it does, it detects something that is called pressure, blood pressure. Today I'm only dealing with blood pressure. It detects blood pressure, it detects blood volume, and electrolyte imbalance. When I'm saying electrolyte imbalance, I mean if you have less sodium, if you have low potassium, this thing, people, this thing that you are seeing, the Bowman capsule, is the end. Here, there are these things that have grown end. But there are so many. so that when blood comes in, they detect the pressure of blood that the heart is pushing towards you, inside you, towards you. You get it? It detects the pressure. And what detects the pressure? You see, this is one that I've drawn here. This is one. But there are many. But these many ones inside here, the kidney, there is some juxtaglomerulus cells here, these things that I've drawn just here before the before the blood enters, they are called juxta. Sorry. They are called juxtaglomerulus cells. These ones are cells. Remember this thing that I've drawn here. There are so many, and they are inside here in this thing. Many glomerulus. So as blood comes, it fills these Bowman capsules. It fills, and when it fills these glomerulus, this is how your pressure is detected. Now look here. This is how your BP is detected. This one here, the vein that takes in blood is called afferent. It is bigger than the one that is releasing the blood. Remember, we are talking about this thing, Bowman's capsule. There are many inside here. Many Bowman capsules, but they are served by this vein. Today, we are just talking about blood pressure, a simple unit, how the functionality of blood pressure is solved by your kidney. The whole thing, when I will talk about the function of how the kidney functions in another topic. Today, I'm talking about how it balances blood pressure. So as efferent comes in, and then you see this capsule here, as the efferent comes in, and remember, you see this is something that is carrying blood that is filtered, taking it away. This one, saying the vein is here. It is carrying blood, filtered blood, taking it back to the system. You remember, this is not only one. I'm insisting. There are many around the kidney, many inside. So I'm using one for illustration. So when blood comes in here, and maybe yesterday you diarrhea, you are vomiting, you lost sodium, your blood volume went down because diarrhea makes you lose blood volume, and the heart is pumping. And then these ones, the cells, these cells that are here, they are here where the glomerulus are, they sense that there is low blood pressure. There is no juxtaglomerular cells. They sense what? They sense that there is low blood pressure. Do you know what they do? They release something called renin. These cells release something called renin, the hormone called renin, RAS. They release renin. Get it? Today I'm just talking about how blood pressure is solved. It is called the RAS system. They release renin. So what does renin do? We go back to the liver, where something called angiotensin is produced. Yes, it is raining. It is really raining. Put on earphones. Put on some earphones. You will listen. So when the liver produces something called angiotensin, readiness for balancing of blood pressure. That thing called angiotensin is not active in your body. It is not active in your body. Angiotensin is not active in your body. It is just there produced to be ready to help. Angiotensin. You get it? So the liver produces it and it keeps on running around your body without any help. But we have said when these cells of the Bowman's capsule detect that you have low blood pressure, detects that you have low blood pressure. And what can make you to have low blood pressure? It is very important to get to know what can make you have. No, I put this one here. Yes, this one. No, that one here is not. Okay, let me put it here. Here. I need a board. I think I need a board and a big camera space so that I can be explaining. So, when these cells detect you have low blood pressure, let's see what can make you have low blood pressure. Low blood pressure. Just a minute. So, factors that can make you to have low blood pressure. Maybe you are sick and you are having a diarrhea. You get it? Maybe you are having a bad stomach and the diarrhea makes you lose water and makes you lose and makes you lose some electrolytes. When I'm talking about electrolytes, when when you are diarrheaing, you lose some salts like sodium, potassium, and then your pressure goes down. Eh? Stress sometimes can make your pressure to go down. Heart problems, endocrine disorders like adrenal insufficiency, severe septic shock. You have infections until your BP goes down. Margaret in Norway, my friend, sometimes I see some people and I feel I just want, guys, go subscribe to Margaret in Norway, subscribe to Barbara, subscribe to Mercy Grace. They have good content. And God will bless you for subscription. I experienced it that once, but I felt like I was going to die the next minute. What did you experience, Barbara? Tell us. Severe shock and blood loss. Sometimes your you can cut yourself and you get blood loss. You get it? Nutritional deficiency like B12 and some medications can make you to have low blood pressure. But today we are talking about how the kidney balances pressure. So, okay. Now, Barbara experienced it. These cells detect that your pressure, the pressure that the blood is moving through to the Bowman's capsule to be filtered is low. What does they do? They release the renin, the culprit itself, renin. And then renin attaches to the one that is produced from the liver, which is called angiotensin. Angiotensin. Do you know what it does? Renin converts angiotensin to angiotensin 1. Angiotensin 1, renin converts it to something called angiotensin 1. Angiotensin 1. You see, it converts it to angiotensin 1. Then there is an enzyme in your body that is called angiotensinogen converting enzyme. So angiotensinogen converting enzyme converts angiotensin 1 that has been already converted by renin to angiotensin 2. Now, angiotensin 2 is the mother of all crises. Angiotensin 2 is the mother of all crises, my friend. You get it? It is the mother of all crises. What does it do? This one, the cells detected that there is low pressure for filtration here. And that's why when you are having low blood pressure, your kidney suffers. Because these Bowman capsules, they don't have enough pressure, so they fail to filter and they shut. That's why you really need enough volume to continue pushing and pushing you up. You get it? Pushing and pushing you so that this can be open to filter the blood. So we say, sorry, some people are really disturbing me by phone while I am teaching some people here while we are live. So we say that, let me just finish with these people. Please, 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 let me tell them that I am online and it's a short 8:22. It is a short session and we should take it as we see. Now, as the filtration goes on, you don't have enough fluid. We have reached whereby angiotensin converting enzyme has converted angiotensin 1 to angiotensin 2. Angiotensin 2 is the real culprit now. Angiotensin 2 is the real culprit. Why is angiotensin 2 the real culprit? It awakened something called aldosteron. Aldosteron. And what did we say about aldosteron? Aldosteron loves salt. I want salt. I just want to lick salt. And where does the salt go? When aldosterone hormone is released to your body, what happens is it retains salt inside your blood vessels. It retains salt in your arteries. It retains salt in your veins, in your capillaries. Why? Your blood pressure is low. We need more fluids. And where salt goes, what follows? Water follows. Like how I like singing to Margaret in Norway. Every time Margaret in Norway goes to a channel, I'm there. So I sing to her, where you go, I go. Where you stay, I stay. Where you move, I move. I will follow you. Nataka nikuepeke, si lazima nijue nia yako. Let me stop there. We continue with medicine. Now, Margaret, where you go, I go. Yes, beauty. We are talking about how the kidney balances blood pressure. Yes. Now, angiotensin 2 has released aldosterone. China Mary Simba is here. Blessed love China Mary Simba. Follow follow from Barbara. And beauty, welcome. Guys, one day I must meet Beauty. After I go to Jamaica next year is my year of traveling. I will drop to go and visit Beauty. Even if it's a half a day, I will go. Now, we have talked about the angiotensinogen 2 releasing what we call aldosterone. Aldosterone is a hormone that retains salt inside your blood. So if more salt is inside your blood vessels, if more salt is inside your capillaries, your arteries, your veins, what will happen? Water that is in the tissues, the muscles, will go back because salt carries what? To the vessels. And when it goes back to the vessels, what happens? Now your BP comes back to normal because the pressure here, because the blood that was flowing was low, Now the pressure has come back to normal. You see, guys, if you are coming back, hi Margaret, no live today. Margaret in Norway, give us a live, please. This one, the people that are coming in, this one is called the Bowman capsule. In the kidney, there are these small things that have drawn inside here. So blood comes in and goes up, out filtered. There are so many times. And then filtration, after filtration, the clean blood comes here. It goes. And then the bad the dirt that has been filtered goes out, and then you urinate. Now, we have talked about aldosterone. There is something else that angiotensin 2 does. Angiotensin 2, welcome, Rich Kusu, welcome. Welcome, and as you come in, please give me a thumb. Give me a thumb. So there is another hormone that is called antidiuretic hormone. And I've said, what is antidiuretic hormone? Antidiuretic hormone means, anti means I don't want. I don't want. Diuretic means water. So I don't want to lose water. Antidiuretic hormone. I don't want to lose water in my body. I don't want. Have you ever had an Indian speak? I don't want to lose water in my body. I don't want. So angiotensin 2 comes in, releases aldosterone and antidiuretic hormone. The antidiuretic hormone makes sure that your blood vessels does not lose fluids. They stay in the blood vessels so that the pressure can go up. And that is how the kidney balances your blood pressure. Very simple. Imagine. Very simple. So this Bowman capsule is served blood from the vein. Let me just summarize. Today it was a short session, a very short session, but you can rewatch so that when we will be starting to talk about blood pressure complications, people can understand well. This one is a very critical part when it comes to drugs that you use for hypertension. Now, let me summarize. Blood comes in, it is filled in the kidney. The Bowman capsules that are many here, they get blood, and then the juxtaglomerular cells, they sense that the blood pressure is low. So when they sense that the blood pressure is low, what happens next? They release a hormone called renin. Renin is a hormone that picks another thing that is produced from the liver that is called angiotensin. Angiotensin. This angiotensin, when they bind with renin, what happens? It is converted to angiotensin 1. And angiotensin 1 likes an enzyme in the blood that is called angiotensin converting enzyme. It eats it, they bind, they fall in love, and they produce a monster that is called angiotensinogen 2. Angiotensinogen 2. Now this is where the crisis comes. Angiotensinogen 2 have the powers to awaken two things. It awakens. I got D in biology. Now I'm learning again. Come on, my baby. Come on, Margaret. My friend, listen with dictionaries in hand, terminologies dog. The bad thing is medical terms, I cannot speak them in another language. Like now, angiotensin 2 releases two things. antidiuretic hormone, and another thing called aldosterone. Aldosterone loves salt, so it retains salt inside so that water can follow the salt. And antidiuretic hormone stops you from losing water. And then your BP comes back to normal. Hello again, beauty. Yes. Now, that is how you maintain your blood pressure. And the main things that help you to maintain the blood pressure are these Bowman capsules. These Bowman capsules are so many in your kidney, and as they filter blood, when blood comes in with high pressure, it is pushed inside here, and this one is small, so it is sieved. And the good blood continues. The sieved blood goes down, the dirty, urea, you understand, creatinine, the toxins, they go. And then there is this that takes it to this vein that takes it to down there to the bladder where urine is formed. But our main concern today was what makes the kidney balance your pressure. What makes your kidney balance your pressure? And you have seen there is good cells in your kidney called juxtaglomerular cells that they are always awake and they are always listening to the blood pressure at the Bowman's capsule. So when you have a problem with BP, when you have a problem with high BP, always check if your kidney is okay. With any person who has a question, because I was just explaining today, it's a short session, I say, explaining how the kidney balances your blood pressure. When people talk about blood pressure, they always talk about the heart. The heart. They always talk about the heart. But you see, in our topic today, we are not just talking about the heart. We are even talking about the kidney. Now, we talked so much about issues that can make your BPs go high. We discussed, and now everyone, if you have not watched that video of daytime, you can go watch it. Let me remove this. People like seeing the heart. The drawing of my heart. The drawing of my heart. That one. People like seeing the drawing of my heart. So my friends, if you have not watched that video, please go watch. It is important sometimes to have a technical know-how, even if medical terms are complicated. I've noticed that some students have started watching and they are sending me text saying that I know how to explain things in simple language. So I noticed so many students are learning through this platform of mine. And I thank God that I'm helping students and I'm helping some people. So, friends, now that you've learned that the heart, when you talk about heart issues, blood pressure, when you talk about blood pressure issues, we are not just talking about the heart. We are talking even about the kidney. The kidney, you understand? When you go to a hospital and a doctor, sometimes medical services are expensive. That one I understand. I work in a hospital. I work with patients and I understand medical treatments, medical services at times are very expensive. So I usually tell people, if you meet someone, a doctor who is not fully decked, a doctor who gambles with you will use a lot of money. Why? Because this doctor was trained to This doctor was trained to get a precise diagnostic case on you so that you can, without gambling with many tests, because you can go to a hospital, we take so many tests, like 100 tests, to get only something, one impression, one diagnosis. But someone who has been baked well and knows that this sign is heading to the kidney, this one is heading to the heart, you will use less. So I usually tell people, if you have come to a medical field, please don't play games. Continue learning, continue going to school. I was in school also, just graduated December. I've been upgrading on some courses in medicine. You see, and it helps me to learn more. The more you learn, the more you know, you get to know that you don't understand. And we don't go to school because we love learning. No, it is because we are dealing with patients, we are dealing with human beings. So if your child, if your cousin, your niece says that I want to be a doctor and do a medical practice, tell this person, relative or a friend, that learning will be your friend daily. Hmm? Going to school and books will be your friend, because we don't want to use a lot of finances on help getting people to get diagnosis. So when you go to a hospital, when you go to a hospital and you are requested by a doctor that you are having a headache, and you are having a headache and your BP is high, let's do kidney function test. In hospital, we call it UECs. UECs. Urea, electrolytes, and creatinine levels. Don't tell the doctor that I know myself, just give me drugs. Now that you know all this, at least it will help you to be easy. You better use money in getting a diagnosis and use less money in treatment, rather than gambling with the treatment with a lot of money and you don't know what you are treating. You get it? So, guys, today I was just telling you how the kidney works and how it balances pressure. So, anyone who is here who has a question before we leave, today now it has been just a short period. It's short period. And remember to connect to each other. Please connect. Connect to your friend. Ask your friend a question. Go to your friend's channel. Advise your friend a content that can suit him or her. You know, creating content is a complicated thing. Yeah? Creating content is is a complicated thing. You may think you are doing a good job, and people are looking at you saying, what is this person doing? Yes? So when you visit your friend's channel, advise this friend, here, do this, go and shoot your video here. According to your content, this one will give you more likes. You get it? It's very important. So anyone with any question before I leave, I wanted just to expound on the RAS system. The renin, so we have said in in uh, in the kidney, not the heart. There's those complicated words that people are complaining. Renin, renin, angiotensin, angiotensin 1, angiotensin 2, aldosteron, antidiuretic hormone. And all of them, they are the juxtaglomerular cells. The juxtaglomerular cells. This thing called the Bowman's capsule is the one which controls everything in your kidney. So anytime you release renin, just know. Anytime you release renin, just know your BPs are going high. But if you take a drug that can stop renin, just know you are fine. I can't go without a question. Please ask me any question, please, before I leave. Urea electrolytes. Urea electrolytes. Urea Electrolytes are your kidney balances sodium, potassium. Hmm? Those are the main electrolytes. Urea and sodium and potassium. You see, UECs. Rich Sue, what was your question? Hmm? What was your question? And I think you have a very nice question. Hmm? Creatinine is also, as you know, your blood carries sodium, it carries potassium to help your heart. Sodium balances the water balance in your system. You get it? So all those are balanced at the Bowman's capsule. Bowman's capsule, this one, let me bring it here. They are balanced at the Bowman's capsule. uh, they are balanced at the Bowman's capsule. And these cells that are here, these cells, are the ones which senses when the pressure is down, they sense when your sodium is down, and they activate coming out of renin, the enzyme. So, Rich 2, what was your question? Please ask. What was your question? Urea electrolytes. Electrolytes are sodium, uh, potassium, creatinine, all those that are balanced here so that your pressure can be okay. I am waiting, please, before I leave, only 10 minutes before I leave. Anyone with any question, please expound on that question, Ritsu. Ritsu, expound, just expound, we see. Or you can just say when we do kidney function test, kidney function test, kidney function test. What will anyone, I'm waiting for Ritsu to expand, but I think she's contented. And I think it's time to go until tomorrow. We find out about complication of hypertension. What brings hypertension tomorrow? Tomorrow we are going to learn about what brings hypertension. So if there is no question, it is 9:43, and I think everyone is contented with the topic, and I will leave now. I will leave now. Have a lovely, and management too. Yes, and management. We will deal with management after we have gone through. You see, Mercy Grace, you cannot deal with management. Yes, Leila. Imagine when you are telling people how to manage something and you have not told them how it is coming. That's why I'm trying to explain all this. People go down and they watch the video and they understand. So when you start dealing with management, at least someone has a technical know-how how to manage. So thank you so much for tuning in. Let's go to support anyone right now who is online. Let's go to support anyone who is online on our circle. And it's time for Rogers Gilia. We meet at Rogers Gilia. Bye. Let's meet tomorrow. If you have a question, bring it tomorrow. Remember, my time always is 16:30 East African time. Have a good night, good day wherever you are. See you tomorrow. Bye.